This is Rob Thompson with Mackenzie Campbell, Alexandra Greer, Andrew Rosal, and Charette Charlton, and this is our presentation on infection control and patient safety in hospitals. Let's first talk about the history of infection control in hospitals and some of the important people and events that have led to current practices in hospitals around the globe. Ignaz Semmelweis was a Hungarian physician who is now known as the early pioneer of antiseptic procedures. In 1847, while working at the Vienna General Hospital, Semmelweis discovered that the infection rates of puerperal fever in women with physician-assisted childbirth resulted in 1 in 5 women dying after childbirth. He also noted that women that had midwife-assisted childbirth had a much lower infection and mortality rate. Semmelweis hypothesized that the physicians are causing the infection due to their work with cadavers before they deliver children, and speculated that infection rates could be drastically cut by the physicians washing their hands with a chlorinated lime solution. Despite various publications of results where hand washing reduced the infection and mortality rates, Semmelweis's observation conflicted with the established scientific and medical opinions of the time, and his ideas were rejected by the medical community. Some doctors were offended at the suggestion that they should wash their hands, and Semmelweis could offer no acceptable scientific explanation for his findings. In 1865, Semmelweis was declared insane and committed to an asylum, where he died due to blood poisoning after cutting his finger while being forced into a straitjacket. Semmelweis's practices earned widespread acceptance only years after his death, when Louis Pasteur confirmed the germ theory and Joseph Lister, acting on Pasteur's research, practiced and operated using hygienic methods with great success. In the 1860s, Lister, a British surgeon working at the Glasgow Royal Infirmary, developed the first antiseptic surgery techniques. Building off of Louis Pasteur's germ theory, Lister speculated that if Pasteur's germs could cause meat to rot and milk to spoil, that these airborne microbes could also be the cause of infections and wounds. Lister developed a carbolic acid spray that was used to disinfect operating theaters, which also prompted physicians to wear gloves while performing surgery to avoid dermatitis from the antiseptic spray. Along with antiseptic techniques, asepsis techniques also helped decrease infection rates in hospitals. The difference between antiseptic and asepsis is simple. Antiseptic techniques involve the use of chemical solutions in order to disinfect instruments and possible infection sites, whereas asepsis techniques involve the use of sterile instruments in order to avoid the infectious organisms altogether. Surgeons began to use sterile instruments, gloves, gowns, masks, filters air, etc., in combination with disinfectants. Aseptic techniques were the primary means of infection control up until the late 1950s.
Hospitalized patients, 7 in a developing nation and about 10 in a developing nation will contract a hospital-acquired infection. 30% of all ICU patients are affected by at least one hospital-acquired infection a year. Newborns are more likely to contract a hospital-acquired infection, and infection rates are 3 to 20 times higher in developing countries than in developed countries. According to WHO, approximately 1.4 million people worldwide are affected by infections that are acquired in hospitals. Hospital-acquired infections account for 37,000 attributable deaths in Europe and 99,000 deaths in the USA. The incidence rate in the USA was 4.5% in 2002. That is a rate of 9.3 infections per 1,000 patients per day. The Canadian statistics state that in Canada, every year, more than 220,000 healthcare associated infections result in between 8,500 and 12,000 deaths every single year, and these rates are rising. 1 in 9 hospital patients in Canada will get a healthcare associated infection. In fact, Hospital-acquired infections are the fourth leading cause of death in Canada. The direct cost of hospital-acquired infections in Canada is estimated to be approximately $1 billion annually. 30% of all healthcare-associated infections can be prevented. We are the tiny future.
With infection control practices today, there are three main areas that we need to focus on keeping clean in order to decrease the spread of infection. Sterilization of instruments is a very important step to the decreasing of the spread of infection within a hospital. There are over 324 million surgical procedures worldwide every year. If instruments are not properly sterilized, they can contaminate a person's clean environment. Patients who are infected with certain pathogens can contaminate surfaces that are in the area they're within the hospital, and these pathogens can live on these surfaces for days, sometimes weeks. If healthcare professionals touch the contaminated surfaces and then touch another patient, they can contaminate that patient with the pathogen. The cleaning of patient rooms in hospitals is most often inadequate, therefore putting the next patient at risk for contracting this pathogen. If cleaning and disinfecting of the environment around patients is improved, then this will reduce multi-drug resistant pathogens. Monitoring is the last step to creating a clean environment within the hospital. Continued monitoring will help to reduce surface contamination. Finally, clean hands is the most important form of infection control. Transmission of pathogens is most frequently a result of improper hand washing techniques. Pathogens can survive on a person's hands for up to an hour. Therefore, without proper hand washing techniques between patients and the pathogen can be can be transmitted to the next patient. Preventing hospital-borne infections can prove to be difficult. There are 10 ways to reduce hospital-acquired infections. Reducing undercover agents. There are new technologies that can be used to show us different pathogens that have been missed while cleaning medical equipment and patient rooms. There is now an invisible solution that under fluorescent light will show the areas of the room that have been missed when cleaned, therefore helping to train the cleaning crews. Robotic helpers. Uh, there are a couple of different robotic disinfectors that are there today. They disinfect entire areas or pieces of equipment without any residue left. Computer surveillance. Data mining is the hottest new field in infection prevention. The software such as MedMine data surveillance keeps track of all admissions, discharge, and transfer, as well as all laboratory results. The software picks up on trends in different areas of the hospital, such as different people having the same infection, therefore alerting healthcare professionals to this outbreak so that they can take the necessary precautions in order to stop the spread. This software is very expensive, however, it has been proven to help save lives. Bug blasting baths. There are antibacterial soaps that can be used to wash ill patients in which has been shown to decrease the prevalence of bloodstream infections. There is some controversy with this procedure because too much antibacterial soap use has been shown to create and spread drug-resistant bugs. There is not a procedure, therefore there is not a procedure that is recommended for everyday use. Washing with antibacterial soap such as chlorhexidine a couple of days before surgery can prove to be helpful in decreasing infections. Reporting laws. Hospitals are required to report rates of infections, therefore creating an incentive for them to better their rates. Hand hygiene. This is known as the key tool for preventing infection. Basic hand washing can decrease infection hospitals drastically. Check it twice list. Checklists can help to make sure that sterilization procedures are done accurately and at the required times. Originally, checklists were mostly found in intensive care units, however, they are now becoming more and more present in everyday patient care. There's also things called as can't miss kits. These are kits that have all the things in them that may be used in certain procedures, all made up so that the healthcare professionals do not have to go around gathering the proper materials, which can lead to them forgetting something and potentially contaminating different areas. Oral fixations. There are many infections associated with ventilators. In order to reduce bacteria that cause these infections, nurses should clean a patient's mouth, gums, and teeth regularly. The procedure of keeping patients elevated has been proven to lower the prevalence of these infections. Swab and study. Time is an important increase in technology. Test results can take up to minutes now, where they may have in the past taken days. With this advance in preventing infections, healthcare professionals are aware of the infections that are in their hospital, therefore can take the precautions necessary to stop the spread.
So we decided that we would analyze the infection control issues in hospitals through one of the methods that Carrie taught us in quality improvement earlier in the year. And we chose the PDSA model, which is the Plan, Do, Study, Act. And we just acted out a little skit for each one. So the first section is Plan, which is analyze what needs to be improved. And here's our video for this section. Andrea, come in.
Thanks. How are you?
Good. I called you here because I've noticed that our patients are having a higher rate of infection after surgeries. Any thoughts on that, on what's causing that?
Actually, I've been getting some reports where the doctors aren't washing their hands after they come out of the washroom.
Alright, well that can't happen. So I think we need to set up some monitoring system to ensure that all of our physicians are washing their hands after they use the washroom. So get that done.
Okay, good.
Perfect.
Next section is Do, which is make and apply the changes. And here's our video for this section.
Excuse me, you forgot to wash your hands.
Oh, okay.
I'm in charge of making sure that people wash their hands. We're putting in a new policy.
Oh, okay. I'll see you later.
Bye.
The third part is Study, which is study the results. And here's the video for this section. Andrea, come in. Just who I wanted to see. The infection rates have gone back to normal. So whatever you're doing, keep it up. Any comments on your end?
Well, yeah, it's working, but the surgeons are kind of freaked out with having someone in the washroom checking out for them, so maybe we can change it and put some posters to remind them to wash their hands.
That's a great idea. That'll be far less creepy, and it's a better time use of resources.
Yep.
Final stage is Act, where we employ the changes on a permanent basis or restart the cycle entirely. And here's our video for that.
Ooh, posters. They're so much better than that creepy girl in the corner. Tell me about it.
That some of these skits are a little overdramatic, but they're a representation of some of the methods that Carrie has taught us. Thank you for listening to our presentation on infection control and patient safety.